So I've just got my tray, my lower tray. I've removed it from the cast. So I'm just going to trim the tray borders which are rough. You can see that they are rough. I'm just going to trim them. You want to have a thumb grasp, and you want to put your finger to support the tray as you're reducing it. So reduce it like that. Remove all the sharp edges. And once basically it's done, you want to round off the edges by just trimming the sharp angle. Open up frame a little bit. So you want to rotate the tray into the mouth, place it, and you want to check for this on a fork, for the sun fork. Place it, fialam, fialam. Any pain? No. Okay. If the thumb pain. Okay. من برا ولا من جوا؟ Okay. Relax. Here? Okay. Slight bony prominence there. Reduce that, but first let me just check my extensions. Pause, you want to pause? I'll give you an angle. Okay, I'm just going to have a look. You never want to pull out your lips like this. You want to just pull them up a little bit so you can see. And lower the chair so possibly you can see it better. Right? I'm going to look around this side. As I see along that side, I can see that my tray is exactly at the vestibule. I don't have the 2 mm space I need for the green stick. What about this side? افتفهم شوية نص. Okay. Here also the same story. And my frenum. Okay, let me see where's the location of my frenum. I have a small frenum here in this region. So I want to mark that frenum off. Okay, I want to mark it here a little bit. Okay, I don't have any other frenums. Labial frenum, again, small one here. This side, iftafam shoyi. Here, no frenums. Want to come back. Rasa biddam shoyi. Careful lisan fork. So, tray lisan lota. Careful lisan fork. You see that the lingual frenum is trapped a bit. Okay, tamam. Here. So I'm going to open up this a little bit, and that should be fine. So we've marked this spot for the frenum. We said the labial frenum needs a little opening, a little bit there, and nothing else really on the buccal side. On the lingual side, I mark this area as needing to be opened for the lingual frenum. So I'm going to just open up a little bit of an area there, so the lingual frenum is free. Otherwise I'm not going to do anything. So that means that my tray right now is at the vestibule and I don't have space for the green stick. I need to reduce 1 to 1.5 millimeters space of my border in the same shape, so that there is space for my green stick. I do not cross into my my retromolar pad area, I just stop it there. Open my frenum, come here, open this frenum, come here, following the shape of the tray, 1 to 1.5 millimeters, closing up there. Same thing on the lingual. Same thing on the lingual. My retromolar pad area, I leave it, so I don't trim it there. So this I like to trim it on a trimmer because it's much more faster on a trimmer. After due sterilization, you want to trim your special tray on the trimmer, and when you're on my suction, it's going to be very difficult to hear me after that. But basically, I want to trim my tray at a 90-degree angle to the trimming head, like that. Can you see me going along the line there? Can you see that? It's going to come closer to me. Okay. The rest of the trimming we don't do it. So for the rest of the trimming, I want to come back to my handpiece and use my TC burr straight cut. I'm going to round off the, you can see I've trimmed along the line. I'm going to correct anything that is left. Slightly deepen my frenums because I can't deepen it with a trimming unit. Use my handpiece and then I'm going to round the borders off so that they're not sharp. Even on the inside. And you want to just trim off the corners so that they are rounded. As well as on this side. So once you've done that, you're more or less ready. You want to check it in the mouth once more before you proceed. So you want to rotate the tray into the mouth and make sure the patient is comfortable. Fi alam thawa lama mia?
No.
It's okay? Okay. And then if the feng shui. And you want to check for the spacing in the vestibule. So, okay. If I had to pull it up like this, I can see that. I have to probably come. You can see that now there is space for the green stick. Yeah. If the thumbs are in, okay. Can you just hold the hand? Come here. Okay. Pull up this vestibule like this. You can see there's a small space between the vestibule and the tray. If you get too much glare, you can press this button. Reduce the glare. Okay. Tray, relax, relax. If the thumb was cheeks, it will be relaxed. Okay. You see? I have some space. I want you to notice that I have some space in this corner, in this posterior part. Right? But I don't have enough space here in this location. So I'm going to just reduce it a little bit and I'll mark a line. Okay. As you can see, I've placed it and I'm pulling up my cheek and my lip as well, and I see some spacing in. Can I just hold it? Just a little bit, don't pull so much. Spacing here. There is space here, but as I come anteriorly, you come in closer. Osama, you can come in closer. As I come in anteriorly, in this region, it seems to be almost close to the ridge. This region. Here there is space. Here the slightly extended. Okay. All right. Now I'm going to go over to the labial. The labial traya, relax. The labial is also, yeah, if the shway, you support the finger as that. The labial is also slightly needs some more reduction for the labial frenum especially. So I'm going to open the labial frenum. Okay. Okay, in this side, when you see that it's almost at the vestibule, so I need some more reduction in this buccal area. I come to the posterior part. I'm going to move it like this and get the light in there. Come to the posterior part there is space. Very clearly I can see that there is space in this region. Give me a pencil. Here. Pencil is here. Okay. Come on the other side. So you see there is space here, right? There is space here. Here the space seems to be slightly minimal. In fact, here it's okay, but this area, if you can see, it's not really there. So I need to open that a little bit before I go ahead. On the other side also, on the other side also, you can see that it's just okay. This region slightly short. So I'm going to open off this part a little bit and go open up this part a little bit. So I'm going to reduce this part a little bit. Okay, and I'm going to reduce a little bit on this part as well. And I think that should be enough. Reducing